We know that the relationship between a doctor and a patient, especially when you're sick, is incredibly personal. Every one of us has gone through this. It's a relationship based on a trust that the doctor is giving us or our loved one, the best care possible. Protecting that relationship, that sacred relationship between doctor and patient, is at the center of our negotiations.
The bill that we are working on wants to make sure that everyone has access to a good doctor, regardless of where they live or how much money they make, that that doctor can make the best professional decision, and that the insurance company can't say no because of a pre-existing condition or some clause in the insurance policy that comes between you and your doctor's decision for your best health outcome.
Right now, we have so many people who are telling us that their medical procedures are denied routinely because of an insurance company's rules and regulations, or people who are dropped from their insurance when they get sick or when they require certain procedures.
Americans are dying from diseases we know how to treat, living in pain because it's too expensive to get the medicine you need. You hear us talk about this every day, but every day these men and women don't talk about it, they see it.
Although I'm a primary care physician, we have physicians from all specialties and all over the country. And we come here today not to represent the interests of physicians, but to voice the interests of patients. Back home in Connecticut, I take care of low-income patients, people with very few resources, and I can assure you that our healthcare system is not serving them well.
Many physicians, like other citizens, feel ashamed of the poor state of health in our communities. I want to remind us all that this conversation started at least 75 years ago. How can we look our patients and our constituents in the eye and tell them to wait longer?
Together, we have the opportunity to take the first of many steps necessary to fix our broken system. This step should be a definitive one that moves us towards a system that is coordinated, that retains the trusted doctor-patient relationship, and focuses on prevention, and above all else, provides high-quality health care for us all.
After reaching a preliminary consensus with liberals and moderates, we are right on the doorstep of getting 60 votes needed to pass this bill. The provisions Leader Reid included in his bill go the furthest to make sure that insurance company policies don't get in the way of patient care. The bill will guarantee that Americans can buy insurance if they have a pre-existing condition, and make sure they keep it if they get sick. Insurance companies will no longer be able to cap your coverage because they claim you've reached your lifetime limit. We're making sure that when Americans lose their jobs, they don't lose their coverage. And for the first time, insurance companies will have to allow young people to stay on their parents' insurance until they're 26. So this bill is truly historic.
The nature of our democracy is that no bill will be perfect. Surgeons learn that perfect is the enemy of good. Let's do good, senators, and deliver service to all the people now.
We want to spend our time with patients talking about their health, not their health insurance. And we're here to make sure you know that our patients are counting on the Senate to pass this health reform bill. Don't let them down.